Good evening, friends. My name is Eric Hulkran, and for those of you in the chat asking if it has started, we have started. Welcome to today's event for Medicare and the Golden Retirement event presented by the law offices of David L. Carrier. We've got an awesome program for you today with expert speakers, panel discussions after each one of the sessions, and a live Q&A as well. Like I said, we'll have Q&A sessions after each one of the speakers, and what you need to do is put those either in the chat box or the Q&A. If you put them in the chat box, though, make sure you use panelists as well as attendees so that everyone will see the question. Otherwise, they will just go to me. I will divert them if that happens, but if you want to get them to everybody, we need to do panelists and all attendees. All right. And that is not it. We also have a chance for you to attend this event to win a $250 Amazon gift card. All you have to do is be here. So check the box on that one. And then at the end of the event, we will draw one of you randomly to award a $250 Amazon gift card. So before we get started, we want to give a big thank you to our sponsor, the law offices of David L. Carrier and Priority Health. You can find more info on them in the chat and on our event website. And without further ado, a quick message from one of our sponsors, David L. Carrier.
If you're wondering about elder law, that's the teeny tiny little insignificant bit of estate planning that nobody ever does, and we don't want to waste our time with that, all right? But it has to do with you while you're alive. Maybe that would be important, huh? Think about that. Pursuit of happiness. You gotta pursue a lot of happiness when you're dead, right? Now, you can blight your family. You can do that. A lot of people do. You know, they leave chaos and mayhem behind. That does happen, but it doesn't have to, and it's up to you 100% if you're going to let it.
All right, friends, if you are ready, I am ready. Let's welcome in our moderator for today and my dear friend, Justin Hicks. Justin has been a journalist at MLive since 2014, most recently serving as a public health reporter for the Public Interest Team. He graduated from Central Michigan University. He was previously featured in the Grand Rapids Press as a city government and public safety reporter and in the Ann Arbor News as a local sports reporter. Justin Hicks, how are you, my friend?
Eric, I'm doing well. Thank you. And welcome, everyone. We're happy to have you join us tonight as we chat about Medicare and how to go about choosing the plan that's best for you. We know that the world of health insurance can be overwhelming. Picking a plan can seem daunting, and it can be costly if you get it wrong. That's why it's important to take control of your health care and to know that there are resources available to assist you. That's why we're joined tonight by a handful of Medicare experts who will teach us the basics, answer some of your questions, and offer the guidance and tools you need to make the best decision on what's right for you. So with that, I want to thank you again for joining us. And we'll toss it back to Eric to introduce our panelists.
All right, my friend. And before we do that, we want to know where you are on your Medicare journey. Are you new to Medicare and eligible in the foreseeable future, or are you a seasoned pro, or you're a caregiver or adult child here to get more info on your loved ones and what you can do with them? Let us know through the poll that you're seeing on the top of your screen right now, because we'd love to hear from you. All right, now our first session of the day, a conversation with Jennifer Keevy and Bob Callery on choosing the right plan for your needs. Bob Callery is the regional coordinator for MMAP, a position he has held for 8 years, received his Master of Social Work from Grand Valley State University, and is an MMAP regional trainer, providing training to both current and new MMAP volunteer counselors. Jennifer Keevy spearheads the product development for Medicare Advantage and Medicare supplement products at Priority Health. She has over a decade of experience in Medicare in various roles, and Jen earned a BA from Michigan State University. Without further ado, Jennifer, Bob, Justin, it's all yours.
Great. Thanks, Eric. How are you guys doing today?
Great. Thank you.
Doing well.
Great. Let's dive right in. Bob, why don't you kick us off with an explanation of original Medicare? What is it? What does it include, and what doesn't it include?
Sure, yeah. Original Medicare also goes by the common term of traditional Medicare. Consists of a couple different parts. The two primary parts, Part A and Part B. Part A, the primary purpose of Part A is for hospital inpatient coverage. So anytime you go to the hospital, if you are admitted as an inpatient, the coverage is going to fall under Part A. Along with hospital inpatient, with a qualifying hospital stay, you could also have skilled nursing coverage covered at a skilled facility. Along with also in Part A, you also have some home health benefit and then some hospice benefit. So that makes up Part A. Most people through their work history or through a spouse's work history, there's no premium for Part A. So that's nice. Part B is all your other medical services. So doctor services, lab work, x-rays, durable medical equipment, all those outpatient medical services fall under Medicare Part B. There is a monthly premium per person for Part B, and that starts out at, for this year, a base rate of $148.50 per month. And that'll be automatically pulled out of your Social Security benefits. So A and B, that makes up your primary health coverage. Along with that, if you need prescription coverage, that's where your Part D falls in. And I know later on we'll be talking about Part D, so I won't dive too much into that. But those three parts, Part A, Part B, and Part D, make up the traditional Medicare coverage, your original Medicare. Some things that they don't cover, the common things that we associate with healthcare, dental work, vision services, hearing benefits. You're not going to find preventative services under those parts of Medicare. So many times that's a concern with people. So we'll see where else those benefits can lie.
Okay. Jen, what is Medicare supplemental insurance? I think also sometimes called Medigap. What is it and why should someone consider it?
Yeah, Medigap or Medicare supplement, they're definitely used interchangeably. People need to make sure they know that. It covers the 20%. So original Medicare covers 80% of your medical, so your A and your B, but there's that 20% that you're on the hook for. So where Medigap comes in is it covers the gap. So that 20% that original Medicare doesn't pick up, definitely it will cover, it will vary a little by plan what's covered, but for the most part, it's going to cover that 20%. It is sold, Medigap plans are sold by private insurance companies like Priority Health. I would say people who would choose a Medigap plan. So if you're someone who has a lot of medical needs, or you're somebody who prefers the peace of mind knowing you can pay a monthly premium and not have to pay copays or co-insurance each time you see the doctor or go to the hospital, or if you're somebody who travels or doesn't want to deal with a network, so you don't want to have to make sure that your doctor that you're going to see is in the plan's network, then you might want to consider a Medicare supplement or Medigap plan. You will pay around $100 or more per month for that. It does not include prescription drug coverage, so you would need to buy a separate prescription drug coverage plan. And it does not cover some of the extras, like Bob said. It doesn't cover vision, or under original Medicare, original Medicare doesn't cover vision, dental, and hearing, some of those extras, and neither do the Medigap plans. They cover just what original Medicare covers, and then sometimes some additional worldwide coverage. So that's it.
If you've got an original Medicare plan, you need the Part A and B. You also need the Medigap, and you need a Part D for drug plan, correct?
Well, is that a poll, or are we answering that question?
I would say answer the question, yeah.
Okay. Yeah, I would for sure say you if you're going to sign up for Medigap, you need Part A and Part B. If you're going to sign up for Part D, the same. So you get original Medicare, and here you've got it. It's like your base, your A and your B, and then you either choose to go Medigap, typically, and then you add Part D. You can choose just to add Part D, so you have your A and your B plus a Part D, or you can choose Medicare Advantage, which is typically has it kind of rolls it in. It's the Part C, what they'll call Part C. And that a lot of times has not only the A and the B, but it also has the D included. So.
Yeah. And so Bob, can you explain Medicare Advantage to us? Kind of how does that differ from the original or traditional Medicare?
Yeah, so as Jen was saying, there's really like two main routes to Medicare. You have your traditional coverage, your A, B, D, with a Medigap plan. And then the other main route that you could choose are the Advantage plans, referred to as Part C of Medicare. I view those as replacement Medicare plans. You still have to be enrolled in Medicare Part A and Part B to sign up for an Advantage plan. So they're still going to take that Part B premium out each month. But essentially what Medicare does is takes all the money they would spend on you, gives it to these private companies that offer these Advantage plans and say, here are some base rules, here's the coverages that you have to include, but you manage the Medicare benefits for that beneficiary. So the Advantage plans, they have the same benefits as Medicare A and B, but some of the differences with those policies, they are able to set their own pricing structure, which is very competitive with traditional Medicare. As Jen was saying, they wrap in that prescription coverage, so it's kind of like an all-in-one plan. You don't have to have three different insurance cards. You just have one that you go and show at the doctor or pharmacy. The other nice thing with these policies, they are able to offer those additional benefits, the dental, the vision, the hearing. They'll have gym memberships, other types of benefits wrapped in there. So for those individuals who are looking for those extra benefits, that's a good route to go. The thing to keep in mind, though, is with the Advantage plans, most of them are HMOs and PPO policies, so they do have provider networks. So in order to really take advantage of the low copays, the low doctor service fees that you have with those plans, you want to stay within network. So again, whenever we meet with individuals, that's one of the first questions we ask is to make sure that their providers are within the plan's network.
So Jen, for someone who's deciding between original Medicare plan or a Medicare Advantage plan, what are some of the most important things they should consider about their situation?
Well, again, we've talked a little bit about how original Medicare it's Part A and B. So you don't have Part D. So you need to sign up for Part D. You don't need to, but if you need or want it, original Medicare is not going to give it to you. You're going to have to sign up for it. If you went with a Medicare Advantage plan, most of those Medicare Advantage plans include your Part D, so you wouldn't have to buy that extra. Additionally, as Bob talked about, really the extras are what people look for in those Medicare Advantage plans. So dental, vision, hearing, gym memberships, over-the-counter allowances that allow you to buy items like allergy meds, cough drops, vitamins. Original Medicare doesn't cover any of that. So you're not going to get a lot of those extras with an original Medicare plan. And honestly, there's Medicare Advantage plans out there that are a zero monthly premium. So you could get an original you could be down the path of original Medicare in a Part D plan for say $30 a month, or you could get a Medicare Advantage plan that covers all of what's covered under original Medicare, plus some extras, plus your Part D for zero. So I would highly recommend looking into those Medicare Advantage plans.
Bob, what's the enrollment period for when you turn 65? How much time do you have, and what happens if you miss that window?
Yeah, so the prime window for Medicare enrollment is surrounding your 65th birthday month. So you have your 65th birthday month, the 3 months before, and then the 3 months after. If you sign up within the 3 months prior to turning 65 for your Medicare A and B coverage, and then you select your additional coverage on top of that, your Medicare will go into effect the first of your birthday month. If you delay to the birthday month or the 3 months after, there could be some delays on when your Medicare would start, depending on the month that you sign up. If you miss signing up during initial enrollment, and we're talking about for Medicare A and B, we're talking about for your prescription coverage, there could be some penalties associated with missing the sign-up period. The other important factor is when you'd be allowed to sign up again. So for Medicare A and B, there's going to be a general enrollment period, which occurs January 1 through March 31 with the July 7th start date. For your prescription coverage, if you miss initial enrollment, once you have either A or B, in order to sign up for a Part D plan, you'd have to wait until the next fall, the annual election period, the fall open enrollment period, which many of us know it as. The Part B penalty, just to quickly identify what penalties are. So for Medicare Part B, if you don't have any type of credible coverage through a work that you're working on, I think we'll be talking about that here in a little bit, so I don't want to jump ahead. But every 12-month period you go without Part B that you should have been enrolled would be an additional 10% that you have to pay for the premium. If you incur that penalty after the age of 65, that's going to be a lifelong penalty. And then for the prescription plan, it's going to be 1% for every month that you go without that you should have been enrolled. So yes, you can go without Part D. It is an option, but when you go to sign up later, you could face a penalty. So plus there are other special enrollment periods based on work and moving, things like that.
Jen, what if I already have access to coverage through my employer or my spouse's employer when I turn 65? What do I have to do? Is there anything that I can delay at that time?
Yeah, so I definitely would advise anybody and everyone to compare the coverage through the employer to the individual plans that you can buy yourself. Just because sometimes the coverage that you can buy on your own is better than the coverage offered through the employer. So you definitely want to do your homework on that. If you're actively working though, and you choose to stay on your employer plan, you have to make the choice to delay enrolling in Medicare until you leave your active employment. And if your group is under the size, if it's under 20 employees, you have to sign up for Medicare Part B, because Medicare Part B is primary, or Medicare, sorry, is primary when you're in a small group plan. So that's if you're staying in that employer plan. And also just want to note that once you turn 65, you can't contribute to an HSA anymore if you are on the HSA with your employer.
You can't contribute to the HSA, but you can still collect from it. Is that correct?
Yes.
Okay. We've got a question here. If I'm still working and not collecting Social Security, how do you pay for Medicare?
They'll send you a bill. So it's going to be a quarterly bill. With Part B, so they'll send you 3 months worth of premium, bill you quarterly. You can also set up an automatic withdrawal from a bank account, or you can also, I believe there's an option to pay online too.
So each year after I get my plan, if I like my plan, can I just renew it renew automatically each year? Do I have to do anything? And are there annual changes I should be looking for specifically? I guess we'll aim this one at Jen.
Yeah. Well, if you're in a Medicare Advantage plan, so I want to make sure we're talking about, because there's two places here, right? Or two options. If you're in a Medicare Advantage, your insurance company will send you what's called an annual notice of change, and it arrives by the end of September each year. It includes all of the changes that are being made to your plan, so you should definitely review that. If you're okay with the changes that are being made, you don't need to do a thing. It just rolls over and you're good to go January 1st. If you decide you want to make a change or you want to shop, you have from October 15th through December 7th to make a change each year. So I would say definitely do your homework there and look at that. If you're in a Medicare supplement plan or a Medigap plan, it does not, you also roll over each year. The benefits don't change on those plans. It's just your premium typically will change. They don't follow the same annual enrollment period that Medicare Advantage does. So once you're in a Medigap plan, if you want to make a switch and you're outside that that your window, your guaranteed issue window, you may need to go through medical underwriting. Whereas on a Medicare Advantage plan, there's no medical underwriting. So.
Bob, what type of local resources are available to assist someone who's looking to see which plan is right for them?
So you can always contact throughout the state of Michigan, our area agencies on aging. We also, because the department I'm with, the Medicare, what they call the State Health Insurance Assistance Program, we're a nationwide volunteer, essentially, program that helps provide free and unbiased help answering Medicare questions for beneficiaries. So we're one of the first resources that people have for unbiased help. For those that get their Medicare and U-Book, you flip to the back cover, our phone number is right on the back of the Medicare and U-Book. So we're a good resource to start. There are lots of different senior centers throughout the area. They have trained staff who can answer questions. Many of our hospitals here in town have staff available for answers. Of course, there's 1-800-Medicare. You might have to sit on hold for a while before you talk to somebody. We have all our contacts for all the different plans locally, and you can also search out licensed agents to review policies. Our program, we're not able to recommend any agents that people can talk to, but usually what attracts people to reviewing plans with agents is looking for an independent agent, somebody who is not tied to one or two companies, who can look at all the different companies that are available to give them a wide range of policy options in terms of premium, in terms of provider networks, different coverages that can best suit their needs.
And is there a resource to find out, is there like a state list of independent agencies or anywhere to find kind of who's independent, where they are?
Ooh, you know what? I'm not aware of one. Jen might know of one, but to my knowledge, we actually don't have one of those here in the state of Michigan.
No, not aware of one either. I would definitely say talk to your friends and get a referral. Those are the best way. The best way to get into an agent is to get a recommendation from a friend.
Okay, got some guest questions here. This one, how easy is it to switch back from an Advantage plan back to traditional Medicare? Jen, you want to take that one?
Yeah, sure. Well, you can switch during, let me think here. You can switch during the annual enrollment period. You can also so let's say that you sign up for a Medicare Advantage plan during the annual enrollment period or when you're first eligible, and you decide you're not real happy, or you didn't even know you signed up for that. CMS did launch something a few years ago called the Medicare Advantage Open Enrollment Period from January 1st through March 31st, where you can switch to a different Medicare Advantage plan if you're already in one, or you can switch back to original Medicare.
Okay. Bob, is there a physical or are any pre-existing conditions a concern when you are picking a plan?
Oh, great question, because this is floating around in my head. So with the transition, so people who are interested in Medigap policies, the supplement plans, they have special windows that you can sign up for those policies. The prime window to sign up for one of those is a 6-month window after 1, you turn 65, and 2, you start Medicare Part B. So in that 6-month window, you can get into any supplement with any company, get in at the lowest rate that they offer. Once you're past that window, there are only a few certain conditions here in the state of Michigan that allow you guarantee issue right into getting into another supplement plan. If you don't qualify for one of those rare instances, you're going to have to go through the underwriting process. So that's where the insurance companies are to review any pre-existing history with illnesses, any recent hospitalizations, any conditions that you have, medications, things of that nature. So the concern there is if you can't make it through underwriting, or if you do, there could be waiting periods for services. They could charge you a higher monthly premium. With our program, we frequently run into people who tried shopping around and they were just turned down for supplement plans. So If you miss that once in a lifetime window, it might be difficult based on your health issue to get into a supplement plan, a Medigap policy. So something to consider. That's a big issue to think about when you're turning 65. So.
Absolutely. All right, Jen, this one's for you. This person says, I don't have Part B. I kept my FEHB plan into retirement and I'm 67 years old. Can I get Part B now without a penalty?
Oh, okay, Bob, I'm gonna toss that one to you. Yeah, I'm thinking no, but I just want to make sure I'm considering all aspects there.
So federal employee benefit plans, they are not considered credible coverage for Medicare Part B. So that's one of those things that for the federal employees, they don't need Part B for their policy to work. However, if they don't sign up for Part B and they want it later on, they can incur a penalty for Part B. So another one of those kind of goofy rules out there.
Here's another one that might be a bit more, another personalized one. We are retired military. Is having TRICARE for life as our secondary insurance after Medicare as good as other insurance options? Bob, you want to take that one? You're nodding.
Yeah, sure. TRICARE. TRICARE is great coverage. You are required to take Medicare A and B with TRICARE. So TRICARE is going to act just like a supplement to Medicare. The nice thing with TRICARE is you can either stick with your traditional Medicare A and B as primary, or you're allowed to go with an Advantage plan too with TRICARE coverage. So your Advantage plan would act just like original Medicare. They would pay first. TRICARE would act as a secondary coverage for a civilian facility. So plus that way you can get it all those extra benefits that the Advantage plans offer.
Jen, if I have a high deductible plan through work, can I still apply for Medicare?
Yes, but I think, would you want to stay on your high deductible plan? I guess I know I'm asking this question like somebody's going to answer this. I'm just trying to figure out, are they trying to stay with their employer plan and join a Medicare Advantage, or are they hoping, I mean, I would say, Bob, what are you thinking on the answer on that one? Because I would.
Yeah, so when somebody has a high deductible plan and that's going to be primary, you'd have to evaluate, is it going to be worthwhile for me signing up for Medicare to act as a secondary insurance? You're going to be paying that Medicare Part B premium that, the base rate $148.50. Get my light turned back on. So, are you going to run into enough health services where, the Part B, which is going to step in and cover the 80% of that deductible amount that passes through? So that's kind of when you sit down and you grab a piece of paper and a pen and do a little bit of math. So I went to social work, so I wouldn't have to do math, but I do it every day. So.
Okay. Jen, do Medicare Advantage plans cover outpatient chemotherapy?
Yes.
Okay, that was an easy one.
Mm-hmm. I like those.
Bob, if you are just starting Medicare and you don't sign up for Medigap or Advantage, are there risks or disadvantages to adding at a later year?
So I kind of already touched on the supplement plans where if you're outside of that 6-month, what they call the Medigap open enrollment, that once in a lifetime 6-month period, you may or may not be able to get into a Medigap policy. With the Advantage plans, you don't have that issue. You just have to sign up during an enrollment period. The only catch would be if you delay signing up would be, did you sign up for a prescription Part D plan when you're first Medicare eligible? Because if you didn't sign up for just a standalone Part D and did not have a credible employer plan in place, if you go to sign up for an Advantage plan, you're going to be assessed a Part D penalty. And so that kind of comes as a shock to some people. So if you don't have that Part D or the employer coverage, you got to watch out for penalty on the prescription side. But other than that, you can wait.
You do, and then don't you think weighing the cost of that penalty versus the coverage that you're getting is important too? Because sometimes that penalty is worth paying for the coverage that you're going to get.
Yep. Yeah, especially some of those medications where they are sky high. It's the savings that you get by having the plan, even though you have to pay a penalty, is well worth it.
Yeah.
And what are the advantages of Medigap when compared to Advantage plans?
I would say the big advantage to a Medigap is that you don't have to pay your copays and coinsurance every time you go to the doctor's office, and you don't have to worry about staying within the plan's network. But then it's like, I always just say, if you're somebody who's maybe a little risk adverse, or you have a lot of stuff going on, or you just want that peace of mind, or you travel a lot, maybe consider the Medigap plan. But the Medicare Advantage plans, they travel really nicely, and most insurance companies have made those work really well, whether you're in their network or outside their network. A lot of them will, the traditional HMO, where you're limited to this network and you can't see anybody else, a lot of them pair that with a POS plan, is what they'll call it. So it'll be an HMO POS plan. And those can sometimes work really closely to a PPO. So meaning they have in-network and out-of-network coverage. So don't be afraid of that HMO. And definitely, I would weigh both a Medigap and a Medicare Advantage, because over the years, they've just become closer and closer together.
Bob, I've seen a few questions like this. My wife turned 65 next March. I turned 65 next June. Do we enroll during the fall during this fall enrollment period? And I've seen a couple other questions that are kind of, my spouse is going to turn 65 at one point, and I will be either soon before or soon after. Kind of when do I apply? When does she?
That is a great question. So Medicare, we have to think that Medicare is individual. So everybody is going to have their own Medicare coverage. So spouses, they can have two separate coverages. So you got to keep that in mind. In terms of when one person turns 65 versus the other, they're going to have to follow the rules that are associated with when their birthday is. So for somebody turning 65 next year, we're talking, March, and then later in the summer, they would not have anything to do for this fall open enrollment. They're going to be focused on their initial enrollment that's surrounding their 65th birthday month. So each one of those individuals is going to have to go through that process of if they're not already receiving a Social Security benefit, they're going to have to actively apply for Medicare. If they're already receiving an RSDI benefit, a Social Security financial benefit, they'll get their red, white, and blue Medicare card mailed out to them 3 months before they turn 65, and then they can pick their coverage.
Okay. Jen, is Medicare Part A enough insurance to avoid the Michigan auto insurance coverage in your auto bill?
Oh, that's a good one. I think it has to. I don't know. I know exactly where that answer is. Is that one in the chat so I can make sure to answer it? Bob, do you know that one offhand?
I did a couple months ago.
No.
I know it was for the other penalty stuff, but yeah, for the car insurance, I can't remember right now.
Yeah, let me go back. I will definitely circle back and answer that one.
Perfect. Bob, I'm just going to keep firing you easy ones and give Jen the hard ones. If I have a credible employer plan, can I wait until I leave my job to sign up without any penalties?
That is correct. So, if your employer is over the 20 people, your Medicare wouldn't be primary. You can delay enrollment in Medicare. When you could sign up for Part A if you want to when you first turn 65. There's no premium for that. However, if you are making contributions to an HSA, you want to delay your enrollment in Part A to continue those contributions. You'll just want to stop making contributions 6 months before you want your Part A to start. or when your Medicare starts, because Social Security is going to automatically retro Part A back 6 months. If you already have Part A, in order to sign up for Part B, which you want to do about 3 months before you stop working or when you want your Medicare to start, there'll be 2 forms that you fill out with Social Security Administration, CMS 40B and the CMS L564. So those 2 pieces of info, you'll get filled out. The employer has to help fill one of those out, and that gets turned into Social Security Administration. Does 2 things. One, it allows for a special enrollment, so you can sign up for Part B, plus it would negate any possible penalty for delaying Medicare coverage.
Jen, what's the most common or worst mistake that you've seen from people who, when signing up or picking a plan for themselves for Medicare?
I really think just not, yeah. I have seen people who don't make sure that they're drugs. So if they're signing up for, say, it's common, signing up for a Medicare Advantage plan, they don't double check that their drugs are in the plan's formulary. So they're not covered, and then they're on the hook. They have to pay out of pocket or get some help trying to pay for those. Additionally, the providers, making sure that your doctors are in the plan's network. Again, if you're signing up for a Medicare Advantage plan. Those are the big ones. I don't know, Bob, have you seen anything else that?
The other common one I'll run into is not having credible prescription coverage in place. So just like a Part D plan, so they'll incur the Part D penalty. So.
Yep.
What would you recommend, Bob, for someone who's 64, they're still months away from enrolling in Medicare? What prep work should they do to make picking a plan easier for them?
So for those individuals, I still have them come into the office, sit down. We do just like what we're doing here, just a crash course in Medicare, what all the different parts are, so they can start familiarizing themselves with all the options, taking a peek at some of the drug plans and what the costs are, so they can start working on budgets, figuring out how much they can afford and what things will cost. So, I mean, it's really, Medicare can be very complex, a lot to wrap the brain around. So getting started early on, it won't hurt you. Just make, the time comes to make a decision on picking a plan, you'll feel more confident.
I know we're throwing a lot at people here, so I like to do kind of a double back a little bit here on kind of what's the 1 or 2 takeaways that you want people to leave this session with, things that they need to kind of be thinking about at the front of mind when they begin or continue looking at which plan is right for them. We'll start with Jen.
Ooh, I have a lot of thoughts around that. I would say do your homework. Sit down. I know it's complicated, but if it's really overwhelming for you, go see Bob, or go find an agent, sit down and really start to understand and narrow your options. Really make a nice long list of all the doctors that you see, all the drugs you take. Write down over-the-counter meds that you take, anything that you need or take during the year, doctors you see, just so you have that list. So every time you're looking at plans, you have that to reference. I think that's super helpful. And also try and identify how often you see those providers, so that you can do that math pretty easily and kind of look back at your records. I would also say talk to your friends, get referrals. Really just go out and talk to people. I think your friends and family are really a great resource. And I have to say, I get this a lot, so I have to just say this one. A $0 Medicare Advantage plan is not too good to be true, but just make sure that you are checking that the drugs are covered, that the doctors are in the network. The customer service is really important. I think people sometimes overlook that. They really need to kind of talk again to their friends, talk to their doctors, find out who has a really good reputation, who's going to make sure that they're taking care of you and getting back to you. So
those are great. Bob, you have some too?
Just kind of build on that. Medicare is very individualized. So what might work for one person may not work for another. We have spouses come in and their coverages are totally different. Really bouncing off what Jen was saying, where get that list together. What's important for you? Many times people come in, they don't know what's important for them. And so as we're talking and looking at different plans, oh, that, that benefit's important, low premium, good nationwide coverage, a dental benefit, things like that. So figuring out what's important for you, and then, try to familiarize yourself as much as you can before making that final decision. So there's good resources out there.
And then I saw a question here with the difference between Medicare and Medicaid, and if you can have both. Jen, you wanna take this one?
Well, the difference between the two depends on what you're eligible for. So, not everybody's eligible for Medicaid. So there's you could be eligible for many different reasons. You can have both. I don't know. I'm trying. Bob, any more to add to that? I think.
Yeah, sure.
Yeah.
Yeah, Medicare, you're 65 and over. Also under 65, if you've been on Social Security disability for 2 years, you'll automatically be eligible for Medicare. So that's what triggers Medicare eligibility. Medicaid, so we have 30 plus Medicaid programs here in the state of Michigan. So there are some non-financial qualifiers. Are you enrolled in Medicare? All these other types of Medicaid plans. But for what we focus on, are you a Medicare beneficiary? And then there are income and asset guidelines that people have to qualify for. So if they meet all those non-financial and financial factors, you can get Medicaid. So both of those programs, you can have both at the same time. Medicaid, always the payer of last resort. So Medicaid's always going to pay last. So if you're eligible for Medicare, you have to sign up for Medicare coverage in order for Medicaid to work. So
awesome. Yeah. Well, I think we covered a ton of ground, and I know we got some questions here in the chat on drug plans, which is going to kind of be perfect for our next session here. But I want to thank you guys, Jen and Bob, for chatting with me today and hopefully answering some questions for the folks who've joined us tonight.
Cool. Thank you.
Thank you so much.
That was awesome, Justin. All right, next up, as Justin said, let's talk about choosing the best Medicare drug plan for yourself. What should you consider when choosing your plan? How do you know which is the right drug plan for you? To give us answers to these and a lot more questions, we've brought you Mike Delpierre. Mike Delpierre is the president and owner of Harbor Drug Incorporated, which consists of an independent pharmacies operating in Harbor Beach, Ubly, and Decker, Michigan for the past 29 years. Michael is a member of the Michigan Pharmacists Association, serving as vice chairman of the PSI board. Michael is a graduate of Ferris State University. And again, you've been awesome all night. Do not be shy about asking your questions in the chat and the Q&A. Bring Justin back. Mike, welcome, my friend.
Thank you for having me.
Yeah, thanks, Eric. Appreciate it. Mike, glad to have you. Let's jump on in here. I know we have this cool graphic. Can you kind of give me the quick rundown on what we have here?
Sure, Justin. What we have here is the standard benefit plan for Medicare Part B, or Part D, excuse me, the drug coverage. A standard plan would consist of a deductible stage where the patient would pay the first $480 out of pocket. Then they go into the middle gap where the plan pays a certain amount, typically it's 75%. The patient pays 25%. And once they meet a out-of-pocket or a spend of $4,430, they go into the coverage gap, sometimes referred to as the donut hole, where they pay up to full amount, or in the standard plan is 25% for generics, 25% for brands. And once they pay out of pocket totally for the whole previous three of $7,050, they then go into the catastrophic. And depending on their situation, you see what they may or may not pay, depending on some on the name brand. Some manufacturers pay a little more towards it versus other manufacturers. And then there are a myriad of variations from the standard plan. Some plans have 0 deductibles, some cover all the generics at 0 copays in the middle section. Some cover generic zero copay and the coverage gap. So it's all a matter of what plan you actually choose based on, as was mentioned earlier, based on what your particular medications are at the time you evaluate your particular needs. Medicare Part D is a individualized program, just like Medicare.
Yeah, let's go into that. The idea of choosing your drug plan. You mentioned this is kind of a standard here. What should you consider when going into choosing your drug plan?
So the very first thing you should consider is there are four aspects that when we help people, everyone wants to look at what the premium is, but really you need to look at what the total cost is. First thing you need to look at is your medications being covered by the Part D plan you choose? Then you have to add up what is the deductible, what is the premium, and what are your monthly out-of-pocket copays? Because you may find a plan that is $30 a month, but it doesn't cover drug X for you, which is $1,000. So it makes that plan pretty much not your best interest. Whereas you might find a plan that has a $480 deductible at the beginning, but pays 95% of that $1,000 bill, and it's a better plan for you. So you have to consider all the different aspects of the financial picture along with your drug picture before you choose which plan you want.
If you're 65, you're getting on Medicare, you don't have any prescription drugs at that time. Do you still need to get a Part D plan, and why?
So you don't have to, but my recommendation would be to choose one at the time you turn 65. There are plans there that you can get. I think in 2021, I think the cheapest plan was $17 a month. I haven't seen the total prices yet for the 22 year, but you got to look at Part D as kind of like your car insurance. You hope you don't use it. The other aspect that was mentioned earlier is the penalty. If you turn 65 and you do not sign up for a Part D plan, you cannot then sign up until we're back in the annual open enrollment period, which we're currently in. Then if you didn't sign up and you had your birthday in January and you can't sign up until it doesn't go into effect till January of the following year, you incur a 1% penalty per month that you didn't sign up. And that penalty is for life on your premium price. So if you wait 5 years, that's a potential 5 times 12 or a 60% penalty for not signing up.
Wow. Okay. So you're going to carry that one with you the rest of the way.
Exactly. Yes. You should sign up. I would recommend signing up to anybody.
Okay. You touched on this a little bit earlier, but the idea of the coverage gap, and you referred to it as the donut hole. Can you explain again specifically what is that? What falls into that?
So what that is when a person spends out of pocket or incurs X amount of, depending on their plan, of expense from using their plan. Let's just say it's $1,000 for round numbers. Once you've gotten $1,000 worth of medications, you then go into the coverage gap. And it may or may not, depending on your plan, require you to pay 100% of the price of that medication, depending on the plan you choose. So that's why it's important to consider what your plan does in the coverage gap, where that coverage gap is, because it can change depending on the plan you choose. That's why it's important to analyze all the factors involved.
What are the pros and cons to choosing a standalone Part D drug plan through original or traditional Medicare versus through Medicare Advantage plan? So
there's not really any advantage, disadvantage. They both cover the medications. As was mentioned earlier, if you're going into a Medicare Advantage plan, you certainly would want to make sure that particular Medicare Advantage plan covers all your medications, because that's what you're going to have for the year. And in order to get out of that, you would have to go back to during the open enrollment period for the Advantage plans, you would have to either change so that all your meds were covered, or go back to original or traditional Medicare in order to choose your plan you want to choose. I mean, currently in my county, I believe for 2022, there's about 35 different plans, standalone Medicare Part D plans that you can choose from.
You mentioned the idea of making sure your drugs, the ones that you need at the time, are in your plan. How do you go about finding out which drugs fall under which plans to see if you are going to be covered for those drugs?
It's a great question. So if you're computer savvy and want to try and do it on your own, you can go to Medicare.gov. They do have a plan finder on there. They will allow you to enter your medications into their plan finder. You answer a few questions about where you live, this kind of thing, and it will actually bring up the different plans that are available in your county. It goes by county. You can go see your pharmacist. Many pharmacies and help with giving you information, helping you. We all have, not all of us, but many independent pharmacies have programs that will take the medications if we're filling them for you, or if you were not, we'll put them into a database. It will then spit out to us the different plans for you that would cover your things, cover your medications, tell you what your deductibles are, what your total cost would be for the year if you got them filled throughout the year, the whole year, what your total cost could potentially be.
And when you talk about independent pharmacists, are there any names that would come to mind to the general person in Michigan on who might be an independent pharmacist, or is there a list of them somewhere?
So Good Neighbor Pharmacy is a independent pharmacy network of independent pharmacies around the state. There are several hundred of us in Good Neighbor Pharmacies. There are several under the that you can find under the NCPA, which is the National Community Pharmacy Association, which is the independent pharmacist voice for us. And they have a pharmacy locator, and you can look in, I think in the chat was the link. You can put your zip code in and it will tell you where the nearest independent pharmacy is in your community. We are located everywhere in the state of Michigan.
Perfect. We got a question here. My mother lived to 99 years old without any medications, and I am totally healthy now and not using any medications. What drug plan would you advise for someone like myself?
I would advise a drug plan at this point, probably the least expensive premium. You don't want to pay that penalty. It's cheap insurance at $20 a month. It's like having your insurance. You hope you never use it, but it's pretty cheap. You don't want to pay that penalty. And if you do get some medications, everyone has in their current pandemic stage, we're seeing lots of different things happen, and you just never know when you might need an antibiotic, that kind of thing.
What are some of the more common or most common mistakes you've seen when it comes to folks picking or attempting to pick out their drug plan?
The most common mistake is focusing solely on the premium and not making sure that all your medications are in the plan. The other big common mistake at this time of the year is people will receive a notice from their current Part D plans to tell them that drug X may not be covered next year. And so they need to either reevaluate the plan they're in or talk to their physician about, is there a choice out there for that particular medication? Part D plans, quite honestly, are geared towards generics. And so talking to your physician, nurse practitioner, PA about switching to generics will save you tremendous amounts of money.
When you mentioned geared toward generics, does that mean they're going to be cheaper or going to be kind of pushing you toward a generic brand of what you might be looking for?
They're looking to, generally speaking, each of the Part D plans have tiers. And there's tier 1, 2, 3, and 4. I think they probably all go up to about 6. Your least expensive medications are going to be what we call tier 1 drugs. You're going to pay the lower copays. Your name brand expensive medications are going to be the highest tier, generally speaking, which can range to be hundreds of dollars. Some of them may be percentages. When it gets to tier 6, you may pay 25%. Well, on $1,000 drug, which is not uncommon, you may pay a copay of $250. That's why they're trying to push you. I don't want to say push you, encourage you to look at generics when possible.
Okay. We've got a question here. If I sign up for a D plan, Part D plan this year, then next year I need a new expensive drug on my Choice D plan, how easy is it to switch plans next year during open enrollment to a new plan that covers this new drug?
So it's very easy, actually. So from October the 15th until December 7th each year is the annual enrollment period. You would just go on to Medicare.gov. They have an enrolling plan or an enrollment feature on there. You fill it out, and basically your new plan would start. They will notify your old plan that you're leaving. Your new plan will start on January 1st of the following year. So 23, let's just say 22.
And if you need a new drug, if you get diagnosed with something and you're not in that open enrollment period, and it's not on your plan, what's the situation then? And are there any type of like life change situations where it opens up a new period for you?
Sure. So if a medication is not covered on your plan, and there are medications that are in that same class of medication, the insurance company the Part D plan may require you to try the generic. And if the physician can prove or has information that drug X did not work and that we have to use drug Y that he really wants, then they can do something called a prior authorization. Call the insurance company, they will ask a bunch of questions, and they'll send it to their medical team, and they'll determine whether they're going to cover it or not. What was the second part of that one?
If you have like I know with insurances, if you have a life-changing event, sometimes it'll open kind of your enrollment.
Yeah, so there are some life-changing events that can happen if you go into long-term care. You can change your Part D plan, and that's about off the top of my head. Really, all there is. The other key feature that kind of ties into this is if you move around or go to Florida, go south, you should definitely look at a plan that's nationwide. There are plans that are national, and there are plans that are only work like locally. So you want to definitely look at a national plan.
Awesome. Okay. So we've touched on a lot here. If there was 2-3 things that really stood out to you, or things that you want people to kind of their key takeaways, what would you say would be those?
If you don't feel comfortable, speak to your pharmacist. Speak to the agent that they were talking about earlier. They also sell plans, help people with plans. They can help you. Just do your homework. know what your medications are. It's very helpful when people bring their list in to us, and we can do it fairly quickly and painlessly for everybody. So just be prepared. As they mentioned earlier, be prepared. It's a big project.
This question says, do you have to have prescriptions filled by mail order if you have a Plan D?
So many of the Part D plans offer a mail order component. Do you have to have them filled by mail? The answer is typically no. It is no in Part D. There are certain plans, though, that will give you a financial incentive to have it filled by the mail. And quite honestly, those plans also own the pharmacy. So, for instance, if you come to my pharmacy and you get drug X, your copay may be $5 for 90 days. If you get it through the mail, through their pharmacy, it might be free. So it's an option to be able to get mail order. Some will push it harder than others.
All right. Awesome, Mike. Well, thank you so much for taking some time today to chat about Plan D and how to pick a drug plan for you. If there are any other questions that kind of slowly trickle in here in the chat, I would invite you to hop on in there and answer them there.
Will do. Thank you. Thank you.
Awesome. Thanks, Mike. Thanks, Justin. That was an awesome segment. And as a reminder, at the end of this next segment, we're going to draw the winner for the $250 Amazon gift card. So stay tuned as we welcome our next speaker, David Carrier, as he discusses what comes after Medicare. Let's call it the rest of the story. David Carrier is happily married, father of 4, oldest brother of 8, lawyer for over 30 years, graduated Notre Dame, received 2 law degrees from JD Boston University and of law and the Georgetown University Law Center. And as always, do not forget, you've been doing it all night, get those questions in the Q&A box and in the chat. And without further ado, I will get out of the way and let David Carrier do what he does. David?
Oh boy, Eric, thank you for that wonderful introduction. Never heard that one before. That's excellent. Before we get started, we've got a little thing for you. You know, Medicaid is the rest of the story. Medicare, so important. You know, you need a kidney, you break your leg, but where would we be without Medicaid? Well, we'd be Ginger without Fred. We'd be Fred without Wilma. You know, the Medicare is your insurance program. Your Medicare is what takes care of things when you're injured. You need a new kidney, a new knee, get into a car accident, have a heart attack, all that kind of thing. But the rest of the story is Medicaid. The two really go together. And the beauty thing about it is they're both really kind of insurance programs. It's just that Medicare, we call it an insurance program, and you really can't deny that. Medicaid is the insurance program, the long-term care insurance program that you've been paying into for years. You've been paying into it, and other people are getting the benefits, not you necessarily. What we're going to do tonight is explain how Medicare and Medicaid, 2 great programs that can work really well together. And we're going to explain just how it goes. But you know, one of the things that most people don't understand is how all this probate works, trust works, all the rest. So we're going to kind of take it from the top as far as that goes. So here's the idea. Excuse me, this is you, you know, damsel in distress, maybe, I don't know. This is you. And the way that most people go through life, is like this. We pile up some stuff. It could be a house, could be a car, boat, money, your 401k. You're like the shopper at Meijer, let's say, shopper in the supermarket. If you're a guy, Cabela's or Lowe's, okay, whatever, you're carrying your stuff around. It's all in your name, right? Now that Medicare doesn't care how much stuff you're carrying around. Medicare does not care. Medicaid cares. If you've got stuff, Medicaid is not going to help. But now here's the thing. If you slip and fall, if you die, if you become disabled, You go from having complete control over your stuff to no control at all. That's when probate gets involved. This is Justin, the probate judge. The judge's job is to clean up your mess. Do you see? The way probate works, it's you made a mess, you were in charge, you're not in charge, you made a mess, now we got to clean up the mess. But as long as you're alive, even if your stuff is still scattered all over the place because you're disabled, maybe it's dementia, what have you, well, that's where hourly bill comes in. Hourly bill is probate costs, is attorney fees. Can you guess why we call this fella hourly bill? Okay, you get two guesses and the first one doesn't count. Right, hourly bill. Now, the way Medicaid works is this. Once all of your stuff has been devoured by the court system, by the attorneys, by the nursing home, then Medicaid will step in. Here's how a trust works. Here's how a trust avoids probate. What you're supposed to do is you take your stuff, you put it in the trust. When you do that, if you slip and fall, whoopsies, you slip, no mess, nothing for the probate court to do. This is a disability, nothing for hourly bill to do, okay? Now, we also have Red Gretchen over here. Red Gretch, that's the last step in probate. After you've died, if your stuff has gone flying and you received help with the Medicaid, the state wants its money back. Gretchen, hungry, wants the money back, okay? What we're going to do, what we have done for literally thousands of families, tens of thousands of families, is we're going to protect the assets. We're going to make sure that those assets that you have are protected from not only probate court, Medicaid as well. Understand that most people with trusts, if you have a trust and you say, hey, I'm going to avoid probate, you're probably not going to. And the reason you're not going to is because your stuff is not actually in the trust. You still have the stuff in your name. So at death, right, if Medicaid has left you anything, it's going through probate, which means hourly bill gets a share, which means Gretchen gets a share, okay? The state gets paid back. Well, you've heard, of course, house is protected from Medicaid, which is not true. They're coming after it in probate. That's why it's so important to set up a pre-plan. You know, we're talking a lot tonight about if you're 64, you should be thinking about the plans that you're going to be involved in. If you're eligible for other benefits, you need to be looking at all those things in terms of deciding which Advantage plan is the right one for you. You know, how are you going to maximize what you've done? How are you going to do that? This kind of pre-planning is the same thing. The tragedy is that it's folks like you, folks who are listening to this kind of thing. See, what do we know about you? Well, if you're still here, you just put up with about an hour of people who are really dedicated to the Medicare thing. You know, they know the insurance. So there's numbers up there. I've been listening. And there's, there's this level and that level. All right. And you stuck it out. Look, I've drunken 1.5 gallons of coffee since we got started, and I'm still barely awake because it's like, whoa, all these details. I'm glad somebody understands it. I'm glad somebody can explain it. Okay. Well, forget it. I can't explain that part of it. Right. But the fact that you're still here, that you stuck it out, means that you're the kind of conscientious people who, well, dare I say, pay your bills, right? Accept the overtime when you were working, have invested money, have done the good things. You've paid off the house, right? That's the kind of people who stick it out through this kind of thing because you really want to do it correctly, right? You don't want to be stepping on, Ginger Rogers' toes, right? You don't want to, mess things up. You want to do it correctly. And the tragedy is, while Medicare, so important to get that right, Medicare, as I say, is the acute care. But here's the question for you. You've been in the hospital now for 3 days, 3 midnights. Now you qualify for rehab. Is it a broken leg, a broken pelvis? Is it heart bypass? You've been there for 3 days. Now you need rehabilitation. Well, Medicare will pay for 20 days of rehabilitation. And after that, there's a copay for the next 80 days. It's over $180 a day now is your copay, right? And at the end of it, you're on your own. Too bad, so sad, right? Medicaid is from 100 days out. And everybody thinks I get the 100 days. Not anymore. When I started doing this 31 years ago now, yeah, you got the 100 days. They would pretty much spot you the 100 days. No more. There are no 28-day care plans anymore. You're lucky if you get the 20 days of rehab, and now you're on your own. And what's that mean to somebody like you? What it means is there goes my 401k. What it means is there goes the vacation house. What it means is there go my life savings. Okay? Medicaid planning, the kind of planning that we do, where we're securing your assets away from hourly bill, away from Red Gretchen, okay? Keep it out of probate court. This kind of planning will qualify you for the program you've paid for, not just Medicare, but Medicaid as well. Medicaid is the long-term care insurance program that you've paid for with every paycheck. And if you plan ahead, you get just as, you get great service with the Medicare. You're not really worried. What if I have a heart attack? You know that's going to be taken care of. Wouldn't it be nice to have the very same confidence in long-term care? And don't let them kid you. 100% of nursing homes accept Medicaid. There are 2 programs, Medicaid programs, to keep you at home, which is where you'd rather be anyway. Okay? So very briefly, trust planning, if it's done correctly, and it usually isn't, it usually is not, but if it's done correctly, means that you're protected against the expense of probate, hourly bill, and long-term care. Do we have any questions?
We do, my friend. That was excellent. Thank you once again. It's always a pleasure to spend some time with you. Okay, so where should I start? Let's start with this one. Do Lady Bird Trust protect house for Medicaid coming after it, after I die?
Here's the thing. The Lady Bird deed, it's a deed. The people call it trust for some reason, but it's a deed, and it's a transfer on death deed that says, when I die, give the house to the kids. Now, for years, putting the kids on the deed meant you shared ownership with the kid, which was really a disaster in many ways. You couldn't sell the house, et cetera, et cetera. The Lady Bird deed says, I own the thing, but when I die, it goes to my kids. Now, the problem with that is if the Medicaid application doesn't go smoothly because you haven't planned for it, and everybody's at their wit's end, it's a very difficult time when a loved one needs skilled nursing care, right? And so messing up the Medicaid application, and there are a million ways to screw it up, there really are, right? Means now you owe the nursing home a month or 2 or 3. The nursing home sues, the house is not protected. The way the trust is set up, the transfer occurs now, not at death, but you're in charge, again, until you die, and it's protected against the nursing home. So right now in the state of Michigan, 43 other states, the Lady Bird deed does not work, but right now in the state of Michigan, it is a technique that we use, but the idea that it protects, very misleading.
Got it. Awesome. Okay, Rob asks, if I want to retire at 60, this is kind of an overarching question though. If I want to retire at 60, what should I do? And I believe his question is, David, if I came to you and I want to retire at 60, what do we do together?
We find a wealthy widow who likes Bob.
Perfect. All right.
Well, you mean what kind of planning would we do for someone at 60?
I think, yeah, like how does he start to build all of this out, right?
Yeah, so I'm just kidding about the wealthy widow, and Mrs. Bob is probably not really happy with me right now. But so the idea is, well, let's start thinking about this stuff. I always figure age 60 is a really good age to start this kind of planning because it does take a while. It's a step-by-step process. And when you at age 60, you're probably healthy enough. You've got plenty of time to make the system work. At the same time, I recommend anyone who's 60 and says, I'm super healthy and I'm doing fine, take a trip through the wards at Mary Freebed or go over to the stroke clinic at Butterworth. Okay. You're going to see a lot of people your age and younger who are now disabled got the stroke, the aneurysm, heart attack, that kind of thing. It happens. It's reality. Okay. So don't be, but 60, I'm be very encouraging. 60 is a great time to really start taking this stuff very seriously, whether you're retired or still working, either way. Just a thought. People don't do estate planning because they want to, right? I mean, oh boy, I just can't wait to go on estate planning.
Right.
What? Vacation, yes. Estate plan. Generally, there's something that happens. Could be a milestone birthday, age 60. Could be a life event, retirement. Okay. Those are the things that trigger people to get this stuff going. And, and if you just really, really want to do it, that's wonderful. But age 60, retirement, those are the sorts of trigger events in people's lives that really get people to focus on the thing and let's get it done.
Okay. I've had two versions of this question, so I'm just going to pick one of them. Don't your assets have to be minimal to qualify for Medicaid is the first part. Are assets held in a revocable trust included in your wealth when qualifying, for Medicaid?
Yeah. So the idea is that, you can't have anything and qualify for Medicaid. Well, here's a question for you. How much income can your spouse have and qualify? You qualify for Medicaid. How much income can your spouse have? If we're talking skilled nursing, the stuff we're talking about, long-term skilled care, the answer is unlimited. Let me say that again. Unlimited. You can be married to, who was that lady with the hotels? Leona Helmsley. So you can be married to Leona Helmsley, right? And she has an unlimited amount of income and you still qualify for Medicaid because her income doesn't count against you, for example.
Sure.
The other thing is, but let's get real about it, okay? Right now, the maximum value you can have in a home in Michigan is $603,000. Medicaid says you got a house that's worth $603,000, keep it. Okay. Well, if you got a house that's worth $603,000, I guarantee you got furniture that's worth another $100,000 and probably an automobile, which you can keep of any value, right? You got a Lamborghini to park in your $600,000 house, keep it, says Medicaid. So the idea that you really, I got to be the church mouse, that is not correct. The other thing is, it really depends on how you own your property. For example, Mr. and Miss, not the probate court anymore, it's Mr. and Mrs. Church Mouse.
Yes.
Okay. Yep. If they put their house in the revocable trust, the house counts like cash. Cash. It's not cash, it's a house. Yeah, but if you put it in a revocable trust, now it counts as if it's cash. You're disqualified from Medicaid. But now you've got $1 million house, you put it into one of the protection trusts that we do. 5 years later, they don't care that you have $1 million house. You still live in it. You could sell it if you want to. Do what you want with it. Okay? It's all about what have you done to plan? How do you own your property? And the most important thing of all, with all of this stuff is, did you comply and can you prove that you obeyed the law? If you obeyed the law and you can prove it, we have folks who control millions of dollars of assets and qualify, they're in skilled nursing. $30,000 a month, is what they'd be paying out. Well, Now they qualify. So it's really it's really a misnomer. It's really not a good idea to be thinking, oh, I can't have anything and qualify. Middle class Medicaid is available to you if you plan for it, like anything else.
So on that subject, let's kind of go the other way, because there's been a couple of questions in the chat about pricing, and I obviously you don't need to name your pricing, but the overall theme is, David, who are you for, right? Who comes to see you? Is it just a wealthy proposition, or should everybody talk to David Carrier? So I kind of want to throw it up like that.
Sure. My favorite client, my absolute favorite client, single family home that they worked for, they paid off, and something in the bank. Could be, 401k, could be a couple 100,000, 300,000. We get millionaires in here all the time, and that's fine. But I'll tell you, it's folks probably like are on the air right now, folks we're talking to right now who are really the perfect candidates for this kind of thing. Because let me tell you, if you've got $1 million, you're the smartest guy in a room. You're a Superman, right? I mean, you're invincible. People tell me, oh, if I had $1 million, I'd do this planning. I say, no. If you had $1 million, right, you would think, I'm not worried about anything. Now, we've had families that have gone from millions to zero. 2.2 million is the record right now. That's a record that has stood for over 10 years.
Wow. 2.2
million spent on the nursing home. Then they come to see us when they're down to 50,000. It's like, I wish you'd been here a few years ago. Well, that's that. But if you've worked, or like my dad, 16 hours a day, 8 hours at school, 8 more hours at the Narragansett Brewery for 16 years. And he raised 8 kids who are just as stupid as he was, working. That's what we do. Okay. It's that kind of person who's the perfect candidate for us, because you know what it's like, how hard it is to get and how quickly it goes away. And if you've got $1 million, 2 million, you can convince yourself easily, right? I'm invincible. I'm Iron Man. You're not going to lay a hand on me. If you've got 200,000 or 300,000, you can't kid yourself. You can't believe. You can't, and here's the other thing. Here's the other thing that's driving me nuts right now: the nursing crisis. My mom was a nurse, RN. My wife is an RN. My oldest sister's an RN. My daughter's an RN. You cannot believe the crisis that's going on right now with nurses. It's unbelievable. Over 600,000 have already resigned this year. This whole COVID thing, the last straw. It's awful. And in order to get people to work, they're offering double pay on the weekends, $600 bonuses for an 8-hour shift. That's a bonus on top of double time. And they can't find anybody because they're burned out. They're at their wits' end. And what does that mean to you? What that means is that the neighbor lady who would sit with mom for $10 an hour, she's not around anymore. Okay? You can't get a registered nurse for $25 an hour. You can't get a CNA, certified nursing assistant, for $25 an hour. The world has changed in the last 2 years. Everything has just ramped up like crazy. And this ability, which we used to have to some extent, to kind of ignore long-term care, it's not a 2-year process. You don't have 2 years. You don't have 3 years of savings. You've got the normal savings that people have. Now at the end of it, you're flat broke, which seems like an absolute tragedy to me. But the expenses are going up. We're in a new world. We're in a very different position than we used to be, and taking advantage, right? Squeezing that lemon till you get the last bit out. Well, who do you think put the juice in there in the first place? You did. Well, are you going to leave it for somebody else? Well, go ahead if you want to, but it's working people who did it all right. You did everything you were supposed to. You worked hard, you saved, you don't have credit card debt, you've got some money in the bank. You're the folks who are going to pay all over again when it comes to long-term care. And I just think that's wrong. And that's the people that we serve the best. Yeah, we got our share of millionaires. We love them to death. They did well and great for them. I've got a lady who worked the line at GM for 40 years, $1.5 million. Can you imagine that? And you know what she does? She saves 20 bucks a month out of her Social Security. I love that lady. But that's you.
Absolutely. All right, my friend. Always a pleasure to talk to you. We're going to leave it here. And I will say thank you for the time. We had one question in the chat, not related to you, David, but probably related to all the information you've given us in the last 25 minutes, along with all of our experts. Yes, we are recording this. Yes, you will get it tomorrow. So if there's something you missed, or you want to see it again, you will get that tomorrow. But David Carrier, have an awesome evening. And before we say goodbye, I want to get you to the winner of the $250 Amazon gift card. That is Steve Weiss.
Is it me?
It's not you, David. No, it is Steve Weiss. So congratulations to Steve. We're going to email you with all the details.
Congratulations, Steve.
And of course, I want to thank the law office of David L. Carrier and Priority Health for being our sponsors this evening, and to all of our speakers, and to all of you for joining us this evening. It was an absolute blast. I hope you got a lot of value out of it. And like I said, the webinar is recorded. You will get it tomorrow. Have a wonderful evening. Stay safe.
Thank you.